Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley. Today, let's talk about heart health, heart strength, and its direct correlation to the strength of the kidneys and the urinary tract system. Your urinary tract system, old UTIs, kidney or bladder infections, can directly cause problems in the heart if they're not monitored. So we're going to talk about this direct relationship. So if you can look back in your past, if you had UTIs or any type of urinary tract problems, and now you have heart issues, there could be a connection. We also want to talk about some of the signs and symptoms that you can look for according to Eastern medicine and Chinese medicine to give you a heads up to be preemptive so that you can do something ahead of time so that you can clean up the kidneys and that bladder system to help with your heart. So we're going to talk about herbs such as uva ursi. We're going to talk about chrysanthemum. We'll talk about reishi mushroom. And we're going to talk about one of my favorite supplements called HemoGuard, which I take every day that keeps my blood clean. It has papaya, it has ginger, it has ginkgo leaf. So I want to talk about some of the things that you can look out for and that you can do to clean up, to make sure that your heart stays strong. Please don't look at this podcast or listen to this podcast and think, oh, I just want to strengthen up my heart so I have a pretty strong heart as I get older. Remember, in Chinese medicine, the heart is the life force of the day and the kidneys are the life force of night. So these two systems are primary areas that you need to be able to clean up and strengthen so that you have a long, vital life. Not just a long life. I'm talking vital life. I want to have my mind. I want to have my mobility. I want to have the warmth that I need to survive long into my old days. And I want the same thing for you. So how many out there have had UTIs or kidney or bladder infections? Men or women? There are many times that men have UTIs and don't even know it. So what are some of the Western medicine signs in both sexes that you've had this? If you have random hot, warm urination, literally warm urination, if you have bubbles in the toilet bowl, many bubbles that float on top, very foamy. If your urine is ever liquidy, is in almost like it's an oil, ever leave a film on the side of the toilet bowl. Some people say, are you kidding me? That can happen? Yes, it can. I've seen that. Do you have slight orange color? Even signs of old brown color, like there's been blood in your urine. Do you get blood in your urine? Do you get kidney stones? Have you had kidney stones? Do you have flank pain? The pain around the backside, around the base of your ribs? Have you ever had chronic fear or being afraid in your life? Have you ever had smelly urine? Have you ever had dark circles underneath your eyes? These are signs in Western medicine and Eastern, but most primarily in Western medicine world, that you need to go ahead and get checked for a hidden UTI. Because you can go and get checked for E. coli from a medical doctor, from a normal hospital, and they'll say, oh, you don't have E. coli, you don't have a UTI. But you're like, I've had kidney stones and I've had all these signs and symptoms, the urination issues, and I don't have one, is because they don't screen for all the infections that could be there. Point in case, you may have heard this before on one of my membership videos or on Instagram, but it really sticks out to me because one of the people I know, one of my patients, with her permission, I'm telling you the story. She was riddled with UTI type symptoms, and she always had problems with kidney pain, low back pain, or hip pain, tight hip flexors. And I'm going to explain why. She always had this. She would have foam or bubbles in her pee, and she always got extremely tired too in the afternoon. So she was having all the urination issues. She's having the pain. She told me when she was a kid, she had a lot of kidney and bladder infections, and they were trying to say that nothing was there. So I sent her to Microgen DX. Microgen, GENDX. D as in dog, X as in X-ray. And it's a lab out of Texas that looks deeply for hidden infections, like over 50,000 different types. And it doesn't just stop at E. coli. It would go into strep and staph and different Klebsiella, these different types of bacteria. And when you know it, she had so many different types of strep and staph in her urinary tract system. Almost 8, maybe 9 in high amounts. There were some bacteria I hadn't even heard of. But according to the lab, they're heavily involved with chronic infections. Now, why is that important? She would have gotten it missed. But she's also a patient that has had problems with chronic heart flutters, chronic tachycardia type episodes, and even tightness in her chest, where she was afraid she was having a heart attack or a stroke. Now, she had both symptoms. Could it be that one system is apart from the other? It could be, but I think everything's connected. See, the kidneys in Western medicine, let's go over to Western medicine, and then we'll go into Eastern medicine. The Western medicine world, which is awesome, it's, if you look at it, if you had all these signs and symptoms, you need to go get checked like by Microgen DX. But if you have any type of kidney problem, you have to remember the hormones that the kidneys produce. The kidneys will produce a hormone known as erythropoietin. Erythropoietin is a hormone that the kidneys release to tell the bone marrow to release more red blood cells. In case you don't have enough red blood cells, or your red blood cells are damaged, or there's infections in them, or you have a problem with your spleen. Your heart suffers, it signals to your body saying, hey, I need more red blood cells, I need more oxygen, because if I don't, I'm going to do what? I'm going to perish. So your kidneys get the signal because of blood pressure. Now, what happens when you're having a UTI chronically? You're having episodes of sickness like E. coli or strep. It signals to your body to release cortisol for the fight or flight. Remember, the adrenal glands are right on top of your kidneys. So when you get stressed, your I can't even talk, guys. Wow, listen to that. Your adrenal glands literally produce cortisol to release sugar in your blood so you can fight, run, or freeze, basically. So after a while, your adrenal glands can get worn out and it can affect your blood pressure. The adrenal glands also produce another hormone called aldosterone. And aldosterone tells your kidneys, within the little tubes of your kidneys, to hold on to more sodium and to release potassium. Why? Because sodium, like salt, will actually attract water. So if you hold on to sodium within your bloodstream, more water will flood into the bloodstream to create more volume in your arteries. Higher expansion, i.e. higher blood pressure. So if you're in chronic fight or flight and have chronic fatigue issues, your body will use the kidneys as a monitoring system. Hey, we need more red blood cells. We need more oxygen. We need more nutrients to fight off the stress. We need to increase the blood pressure so we have enough blood flowing to our brain and our extremities to outthink our opponent, to run from them or fight them. But what happens when you are thinking chronically over and over again and fatigued from all the fighting? Are you ever just tired of fighting? Are you ever thinking, man, I just don't want to fight anymore. I've got, this relationship is hard on my system. My parents are hard on me. My kids are hard on me. Work is not doing great. School is very, very hard. Now, this is not to be downer. This is for us to look at and go, if those things hit you, you're in fight or flight. And if you had consistent times in your life where it's always happening, then you will really know that there's something going on within your kidneys. If you had the urination issues, you had the foamy pee, you had the flank pain, you had the kidney stones. You see the correlation. You cannot separate them. You really know that your emotions or your bad situation, your fight or flight, is affecting you physically when these things come up. Now, you're saying, yes, doc, I have that. Yes, what do I do? Or you could be out there saying, I don't think I have any of that, but I do have heart palpitations and I have tachycardia. Okay. There could be direct infections in the heart. So if you have that, I want you to right now, please write down, you need to get checked for strep, staph, E. coli, Lyme disease, and parasites. So I have a list of labs I put at the show notes. On every single show note, I put down a list of labs that tell you what they test for. And you can go to those labs, and there's solid labs to give you information about infections that could be in your body. But you want to look for things to be preemptive. So the kidneys will give you a signal and a sign. The bladder will too. So you may want to write this down. I know it's a lot to take in, but this is for your heart health. So let's say you already have tachycardia and you already have the palpitations. You have chest tightness or pain. And you're like, I know something's going on with my arms or my heart. I know something is going on with my heart. So when you look at things going on with the heart in Chinese medicine, you want to look for, they talk about the pain in the left arm or the right arm. Mostly in Western medicine, they'll say, look down for the pain in the left arm. Because the ring finger has a direct nerve that is associated with the heart. And that's why you put the wedding ring on that finger. But the meridian for the heart is in the armpit. Now, just off camera for a second, guys. But if you can see this, if you guys are watching this, you can't really see it. But on this Chinese medicine doll, the armpit is where heart 1 is at. And it literally goes, the heart meridian goes down the inside of the arm, on the inside of that elbow right here. And it will go right down. I'm going to turn it around. It will go right down into the pinky. The inside nail bed of the pinky is where the last heart meridian is at. So what that means is that you're going to have the heart meridian giving you an indication that there is a problem if you have sore pinkies or have sore elbow or even problems in your armpit. That's number 1. The next thing you want to look for is that if that's the case, the kidneys in Chinese medicine will always result in sore hips, tight hip flexors. You can have dark circles underneath the eyes, very dark circles or bags. That's kidney. You can have pain at the collarbone, right where the collarbone meets the sternum. That's kidney 27. You can also have pain on the inside of the knees. Pain that is there. You have no explanation why it's happening, but there is pain on the insides of the knees. Okay? Add in pain on the inside of the ankle bones, which is another kidney area. So internal leg, knee, ankle pain. Dark circles underneath the eyes. The other thing is pain in between the eyes. That's the bladder one. So kidneys dump the urine into the bladder. So they're the urinary tract system. So pain in between the eyes, right at the bridge of the nose. Headaches down the inner center of your head. Thinning hair, loosening of the hair, even in women. Headaches, chronic migraines, even dandruff down the center where you're having thick, dead skin on the scalp. Pimples down your spine. Backache, low back pain, calf tightness and pain, plantar fasciitis, or pain at the balls of the feet. These are all signs and signals that the urinary tract system is off. You can even look at moles, warts, and even skin tags that are occurring at the back of the calves or the back of the thighs. If you have that, that's an old bladder infection that has not been treated. Let's go a step further. If you go into looking at the bladder and kidney infections, emotionally, the emotions of fear, dread, bad memories from the past, unable to think clearly, feeling like you don't belong in a group, feeling like you're stuck somewhere, that I can't move forward in life. My hips are tight. I can't move forward. I can't propel and bend my knees because that kidney meridian is off. Do you guys see the physical and emotional correlation? If I'm afraid, I'll be left behind. Then remember that if you see this with all those other signs and symptoms, that is a preemptive way to know that your kidneys are already fatigued and they're imbalanced. You do need to go to Microgen DX and go see if there's any infections in there. You do need to look for parasites and the bacteria. And sometimes there's even viruses like old herpetic viruses like cytomegalovirus or Epstein-Barr virus. And I like to always start my patients off camera again, guys, off camera again, but I just want to pick up this. It's in my office, but here. Kyanyang Dan. It's by Classical Pearls out of Oregon. And they have Kyan. It's QIANYANGDAN. It's a very good kidney stabilizer and strengthener. And I love it because my mom has had the worst kidney issues, and she had such fear when she was younger that she lived a life in Korea, but her family is very hard. She lived out in the farmlands. Nothing against my family out there. I'm not saying anything bad about them, but she came here at 19 years old with my dad and didn't have any family here. Nobody. And they had 3 kids, and my dad was in the military, and he had to be away. And she was by herself in a country she could hardly speak English. Do you think she was afraid? Yes, very much afraid. And she has such weak kidneys. Every time I've checked her, her kidneys were always so weak. And now I used this verbal formula. After all these years, I found the one that helped strengthen up her kidneys. She's happier now. She's laughing all the time. It's kind of unreal how much she laughs and how much she's joking around, but she does. So using herbals, you don't have to use this one. I'm just saying that there are Chinese medicine herbals that are so good at help cleaning up and strengthening the kidneys that you want to use it to help clean out the fear or help stabilize the body to get your body out of fight or flight. You have to address the emotional component of the fear or feeling stuck to do what? To allow the brain to connect with the kidneys. And then the brain can help the body along going, yes, that part of the kidneys, that emotional file is lodged not only in the kidneys, but in the brain. There's a connectivity there. So if you're seeing all these signs and symptoms, you have to start working on the emotion. That's why I ask patients to do neurofeedback, EMDR, NET, prayer, meditation, seeking therapy or counseling. I love EFT tapping. I love using acupressure on the points of the kidneys, such as the kidney 27. Also, the kidney 6 down on the lower extremities, and the kidney 1, which is right near the ball of the foot. Kidney 27, kidney 6, and the kidney 1. When you start using these points, I'm serious, you will see that it can help you with your emotions. You actually feel lighter. Using this herb or something like this will help strengthen the kidneys and really reduce anxiety and fear. You want to start seeing the dark circles start to go away. You want to see the calf strength return. You want to see the acne breakout down your spine to be released and the hip flexor tightness to be reduced. I also throw in, not all at the same time, I do muscle testing with my mom and frequency testing. And it's Uva Ursi, UVAURSI. Uva Ursi by Supreme Nutrition Products is so great with cleaning the kidneys, cleaning the bladder, and the ureters. I love it. It's one of my favorites. I think it's more potent than cranberry, but you can also use cranberry and D-mannose. Those are amazing too for cleaning the kidneys and urinary tract system. I also like chrysanthemum. Chrysanthemum is on the camera here. Yeah. Chrysanthemum, Vital Guard Supreme is amazing. Vital Guard is so good at raising the internal chi. It's safe for pregnant ladies, safe for kids. It's one of Chinese medicine's overall killer of viruses, mold, yeast, bacteria, parasites, fungi. I mean, it kills off everything. It's one of my favorite, and it's gentle. So chrysanthemum, morifolium. I also never forget mushrooms. Reishi Supreme. So Reishi Supreme is one of my favorites. Now, reishi supreme is one of my favorites because all mushrooms help with the kidney because it's shaped like a kidney. That's why reishi is so good for it. It kills off a lot of infections, especially yeast. It's a fungus that kills off the yeast, but it kills off a lot of parasites and microbes like bacteria out of your kidneys. And again, one of my favorites is HemoGuard. HemoGuard has the mixtures of the ginkgo leaf and papaya and has ginger root, but it's so good as acting like an astringent in your blood cells and in your capillaries and cardiovascular system. It will clean out your arteries. It will break loose all that congealing in the arteries. Now, if you have blood pressure issues or you're on blood pressure medicine, you need to ask your doctor before you even start taking this. But these 4 have been some of my main heavy hitters with kidney infections and bladder infections. Now, I'm not opposed. If you have a heavy kidney infection, but if you do this extra testing like the Microgen DX, you may have to consider heavier antibiotics. That's not out of the question. I'm not a proponent of it. I think they can really hurt your gut if you take them for too long. But if you're having a hard time killing them off, that may have been in there for so long, you may have to consider a short round. So don't be discouraged if you had to do something like that. But if you see these other signs and symptoms in the Eastern medicine world, and then you have that with the Western medicine world, you have a double whammy. But remember, you can use these to start cleaning it up, and you'll start to see your heart healing. I have seen it. I promise you. I am so surprised that when we start to use cold laser therapy, acupuncture points that I just mentioned to you, using the herbs and stimulating the heart points, like the heart 1 in the armpit and the heart 9 down on the pinky, it is amazing that the kidneys strengthening will help the heart get out of that tachycardia or that AFib. Literally, I've seen patients that have not had it anymore because they've taken their health in their own hands. So if you're out there and you know you've had either the Eastern medicine signs and symptoms or the Western, please consider the uva ursi, the chrysanthemum or VitalGuard, the reishi, the HemoGuard. Look into acupuncture to strengthen up the kidneys. Definitely look into any type of counseling or therapy or some form of emotional freedom technique of any sort to help clean the body out, like the neurofeedback brain therapy, to help reset and rebalance. Focus in and check and see when that chronic fear or that feeling of being stuck or paralyzed started in your life. That's where it begins. If you start flushing the physical portions of the kidneys, the emotional aspect will heal and vice versa. I really want you to have strengthening of the heart. Strengthening of the heart is such a big thing for me in my practice because that's where all the blood flow starts. And if I can correlate the connection of the heart to the kidneys and I can find the connectivity points, I use acupuncture and acupressure and I use kinesiology techniques, and we really turn on the kidneys to help turn on the heart. I think it's really funny. I'm not trying to pat myself on the back. It's not. I've just seen some patients that have had like 60% heart function loss. And you start cleaning up their kidneys and they go back and their doctor is like, oh, you're only 30% lower. What are you doing? You just clean up those kidneys, that urinary tract system. If you have a urinary tract system problem, clean that up. And I promise your heart's going to feel better. I know this was a short podcast, but I want to make sure it's short and sweet, to the point. You can drink more water. You can drink plenty of water. But if your kidneys are sick, you won't retain any fluid. It doesn't really help you that much. It's good to drink water. I say drink it all the time. But you have to make sure they're strong and turned on. Guys, I hope this helps. If you have any more questions about the kidneys, please let me know. And remember, look for infections. I mean, there's many out there. Look for strep, look for staph, look for Lyme disease, look for old walking pneumonia bacteria like Clostridium or Klebsiella pneumonia. Look for chlamydial pneumonia, look for strep pneumonia, look for all those things. And never forget parasites. You're going to see it in my link in my show notes that it could be parasites, it could be yeast or mold. Check them all out, because they get stuck in the kidneys because the kidneys are trying to filter all day for you. Treat those kidneys well, and your heart will thank you for it. All right, guys, if you love this kind of information, please let us know. Send us some comments and put it in the show notes, or not in the show notes, put in the captions. And if you have any other questions, feel free to reach out to me. I do have a small membership that I use namely for anybody, like whether it's the novice or the health coach. I try to do my best to help even health coaches with their clients, but you can reach out to me and see what we can do to help. All right. Give us a thumbs up if you like this kind of content, and also subscribe to the channel. I hope it does you good and helps you out a lot. So until next time, guys, I'm Dr. Motley. Have a blessed day. We'll talk soon.